If your doctor has ever recommended hearing aids, you may have gone through a confusing maze of looking at options and trying to find the right combination of the features that will solve your problem with hearing loss, tinnitus, or other conditions, as well as good value and the good price that you can afford. Did you know that hearing aids are the third most expensive purchase in many adults' life after their house and a car? Today's video will give you an edge if you're considering using hearing aids to help you with hearing loss or tinnitus. We're going to talk about the best value out there and what you should expect on the variety of options and the respective cost. My name is Ben Thompson, audiologist with Treble Health. Let's get ahead with section 1 of this video. What exactly is a hearing aid? Most simply stated, hearing aids are little computers to improve your ability to hear. They include a microphone to pick up sound, a speaker to transmit sound, and some infrastructure like computer chips and a battery to keep the whole operation running. And like buying a computer, devices range from cutting-edge, deluxe systems to models that are a bit more durable and mainstream. Some higher priced hearing aids may provide better sound quality and include more sophisticated features for noise reduction, as well as better warranties and other audiology services like fittings, follow-up, and general maintenance. On the other end of the spectrum are cheaper devices that can be purchased over the counter. They typically have less features and less support that go in them. Why do hearing aids cost so much? So it's common to find the range of hearing aids for a pair is typically between $2,000 and $7,000 for solid hearing aids that will do the job right. So why the discrepancy? Why such a big range? Well, first, the devices themselves are expensive due to the research and development that goes into producing them, as well as they're part of the medical system, which typically is a high cost to Americans. The range of price is really an indication that the manufacturers of these hearing aids do not take that much money to manufacture and create the hearing aids. So they work with doctors, and the doctor is really the specialist who can take that hearing aid and make it work for you. It's a sophisticated device that's used for medical purposes. So to do it on your own is a stretch for many users. However, recent trends with the Over-the-Counter Hearing Aid Act allow hearing aids to be programmed by the individual through what's called self-fitting. And that's an option that is worth considering if you're looking for budget hearing aids, or if you have a milder hearing loss, or you want to do it yourself. Now, one consideration that I always want to see is that I really recommend that you get an in-person hearing test. Online hearing tests are not as valid as an in-person hearing test. Although online hearing tests can be reliable, and they're definitely good to give you a sense of where your hearing is, I always strongly recommend going to a local audiologist, getting a hearing test, and from there, you know very specifically how the hearing aid should be programmed. Whatever hearing aid you do get, I want you to know that when it's custom programmed to your hearing loss, whether it's for tinnitus or hearing loss, that custom programming is going to make a big difference with the sound quality. Does insurance cover hearing aids? Well, sometimes, but not regularly. Similar to vision coverage, many plans have a capped dollar amount. That means rather than a percentage or general deductible to meet before providing the remainder of the costs, a minority of insurances provide benefits for hearing loss. The most popular insurance is Medicare, and at the time making this video, Medicare does not cover hearing aids. There's no plans for that to change for a majority of Medicare patients anytime soon, although there is some development in looking at options for covering severe hearing loss with an insurance benefit. When you're trying to find the best price for hearing aids, it's really a question of what's the right value. Now, we all want to spend with budget in mind, and we don't want to spend unnecessarily if we can find the same treatment somewhere else. But when we're looking at the cost of treatment, the cost of hearing loss or tinnitus treatment with hearing aids, it must also be factored in of what's the service that goes along with it. Is this something that I could just get by myself and program it? Usually not. The reason that the medical devices exist and are provided through an audiologist is because those prescription level hearing aids are the best in the market, and the sound quality is drastically better than if you were to do it on your own in most cases. Having the hearing test, programming the devices based on the hearing test, that's going to be key, and working with a professional, an audiologist, to adjust and fine tune them. It's what I would recommend if it's within your budget. There's no question that hearing aids are expensive, and we want to make sure you're getting the most out of what you put in. So that's why it's always important to make sure you work with an audiologist who's well respected, who works at a high level, who provides best practices, and who can get you excellent hearing aids. Now, if you're looking for something over the counter, not all of those devices are created equal. I still would never buy a pair of hearing aids for under $1,000. I wouldn't buy them if they look very cheap, or if you speak with someone who knows hearing aids and the devices that they use look nothing like these cheap devices. I would just be really cautious on certain kinds of online hearing aids or hearing aids you can buy at the drugstore. But the FDA is now regulating over-the-counter hearing aids. So if you see that stamp of approval, it does have a minimum quality standard. And if you're looking for a more value hearing aid, you can go to the over-the-counter hearing aid as an option. Costco is another option that has value hearing aids. And again, always asking yourself, is this a simple problem I have, or is this one where a well-trained professional who can customize and fine-tune it is needed? Or if you're simply looking for the best hearing possible, then you can acquire the best hearing aids with a well-trained audiologist to program them for you. And that means you'll be able to be hearing better in no time. Conversations, speech and background noise, everything that you would need to understand speech clearly. The takeaway, as with all health decisions, make sure you consult a specialist. I would recommend a good audiologist. My name is Ben Thompson, audiologist with Treble Health. If you want to find out more about the work that we do, you can head over to treblehealth.com. Above me on this video, you can click that button above, that video above, and you will be able to watch the best hearing aids of this year, which is a comprehensive video that we made. Hope to see you there. Bye-bye.